Alexa-powered smart speaker and on TuneIn, iHeart, and on Odyssey. Now, from the Signature Bank Studios, this is Chicago's Morning Answer with Dan Proft and Amy Jacobson.
Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy, for all the discussion we've had, warranted at that, about fentanyl. This new drug that we've talked a bit about that goes by the handle Trank. It's the zombie drug. You've seen
disturbing.
Yeah, you've seen pictures and videos on social media of people that are just like
they're zombies. They're bent over at the waist and they're just out of it.
They're dead on their feet, basically taking this drug. Charles Lehman has written about Trank. I guess the actual name is Xylazine, which is a sedative, obviously. And its impact in places like New York City. Charles Lehman is a fellow at the Manhattan Institute, working primarily on the Policing and Public Safety Initiative. He's also a contributing editor of City Journal. He joins us now. Charles, thanks for being with us. Appreciate it.
Sure, thanks for having me on.
So, I mean, give us a sense, since so much of the focus, as I said, has been on fentanyl and fentanyl-laced drugs and the deaths the amount of deaths that is inducing. Give us a sense of the prevalence and the impact of xylazine in places like New York.
Sure, it's been a growing problem, particularly on the East Coast and the Northeast for a while. A substantial portion, I think well over a majority of fentanyl samples now being tested in Philadelphia are test positive for xylazine, which is, I think Philly is where it really hit first, but you're also you see it in places like New York. And it's spreading elsewhere, although much, it's still much less prevalent in places on the West Coast, for example. There are reports in places like Seattle, Portland, but they aren't seeing it the same prevalence yet. As you alluded to, xylazine is a sedative. The reason it's added to fentanyl is to sort of extend and lengthen the depressive state that fentanyl puts you in. It makes the high, quote unquote, better. And I part of the challenge of it, besides its adverse effects on wound healing, which we've talked about a little bit, part of the challenge of it is that it's not an opioid, so it's not responsive to Narcan or naloxone, the opioid overdose reversing drug, which means you can have somebody who's high on fentanyl, you can give them Narcan, you'll deal with the fentanyl, but then you won't have dealt with the xylazine OD.
And how does this jive with the public health, the quote-unquote public health vending machines that are stacked with items like naloxone and fentanyl test strips and so forth? I mean, is this the approach? Is this a sensible public health approach to this drug problem?
I mean, look, I think it's a kind of public health feeder. Is it good to have naloxone around? Yeah, absolutely. If you can reverse an overdose, you absolutely should. Should we expect that it will have a dramatic impact on the number of people who are actually ODing and dying? No, not really. We've good evidence of that now. That naloxone access does not, in the aggregate, reduce overdose death rates. And then everything else, you look at fentanyl test strips. Okay, well, there's evidence that when you give people fentanyl test strips and they find that their drugs are positive for fentanyl, they don't not use the drugs. They use them still because that's how drug addiction works. That delay is not, delaying or just throwing your drugs out is not really an option on the table. And the same thing is true of lots of other things. So, this is all part of an approach called harm reduction. It's a long, storied approach. It's been around really since the AIDS crisis in drug policy and public health policy. There's certain merits to some harm reduction approaches. The idea is you try to make the harm of the drugs lesser so you can, people live longer. But I think what we're seeing in the current crisis is that it's simply not adequate, while at the same time, for mostly ideological reasons, we are very wary of using any of the other tools that are available to us. We're very wary of using enforcement, using treatment, using primary prevention as tools to deter and address the causes of drug use. And so we're left with these tools that are really Band-Aids, not very effective Band-Aids at that.
So fentanyl is mostly coming from China, shipped to Mexico, then coming up through the border. Where's Xylazine from?
Was Xylazine a problem?
So, yeah, sorry. So,
Yeah.
Xylazine.
Sure. So
Sure.
Xylazine is a common veterinary medicine. It's uncontrolled. If you have horses, you can get Xylazine. Even if you can claim to have horses, you can get Xylazine. So it's almost certainly currently being diverted from the illicit market. It should be noted, like there are jurisdictions that have a Xylazine problem for a long time. Puerto Rico, they've had a Xylazine problem at least since the turn of the millennium. So that's part of the United States. So it's not fully new. We've been aware of this as an issue. Congress is now moving to schedule Xylazine, put it on the schedule of controlled substances. There's sort of a big fight about doing that because, quite frankly, people who work with animals are saying this is the best tranquilizer we have for horses, and we don't want it to be harder to produce, harder to get, because schedule will be harder to get. And the response on the other side is, well, okay, but it's killing people, so maybe you gotta learn to adjust. Ketamine is the other horse tranquilizer is a controlled substance, and they are able to still get ketamine.
And so, is there any reconsideration that you see anywhere, big city America, to the singular play of the harm reduction strategy to include actual, to borrow the phrase, just say no programs? I mean, to focus on this isn't about harm reduction. This isn't about safe use. It's about no use.
There's public messaging that's gone up in a number of places that is at least a little bit trying to deter usage. I think they are not nearly as aggressive as I would be, but that's a start. In the city of San Francisco, Gavin Newsom, governor of California, gave the California National Guard the all clear to go into San Francisco to help clear out the Tenderloin. Clearly, policymakers are willing to listen to other approaches. I think ultimately a lot of what's going on is that they still don't understand the scale and nature of the crisis. They're still running 5 to 10 years behind where we are. People are still talking about prescription opioids as though that's a major issue. When prescription opioid OD deaths peaked 10 years ago, I think people just don't really understand what's happening in the streets right now, and so policymakers are reaching for any tool that's available. There happens to be an organized, a very vocal constituency for harm reduction policies, so those guys are at the table. There are a lot of people who are getting up and saying, just say no, so they aren't necessarily getting heard, but it's not to me so much about are they backing down from this policy versus that. It's that I think a lot of big city policymakers are just still trying to figure out what works and what's going on.
But I mean, you also sort of can see there's at least to varying degrees ideological blinders that are attached to a lot of these policymakers.
Yeah, look, I think that's true too. There's a general view. If you ask the American people, 80% will tell you that quote unquote the drug war failed. Nobody really knows what that means. If you ask them what they mean by the drug war, they have no idea. But they will. There's I think this general sense that we have been too punitive on drugs. As a result, we should become less punitive on drugs. And nobody's really sure what that means or what that looks like. There's some conversation about a public health approach, and what I like to say is, as we all learned over the past 3 years, public health can be extremely punitive and extremely coercive.
Yeah,
so it's
right.
not obvious to me. It's not obvious to me that that's when we say public health, we mean the kind of public health intervention that will get results, which in my view needs to be sometimes coercive.
Yeah, you wrote in your article that the health department's response is to have supervised consumption sites. Can you explain that? What does that look like?
Sure, and SCS it's a place where people can go to use controlled substances under the supervision of medical staff, which mostly just means usually, but not necessarily, a nurse who has Narcan available and other tools for addressing overdose if it happens. SCSs have existed across Europe and Canada for a long time. People sort of express a lot of concerns about them. It seems like they don't lead to dramatic increases in drug use, but it's also not obvious that they do a huge amount. The best estimate we have is that the SCS in Vancouver, which is the longest operating one, handles about 5% of drug use sessions in the city in any given day, which is a very small fraction. So I like this is it's another of these Band-Aid approaches. It's like, well, let's have a place where people can go where they can be sure to get Narcan. And it's like, first of all, many people, if you're using every 2 hours, if you're using 6 to 8 times a day, you're not going to the supervised consumption site for all of them, and you only have to get it wrong once to die. And then also B, it's not focusing in on why are people using drugs. There's an argument that SESs are supposed to refer people to treatment, but they almost never actually do that. So it's another Band-Aid approach. It's a thing that you can do easily, but isn't obviously one that's really addressing the crisis.
I want to go back to what you said about American people generally want us to be less punitive toward drug use, and they don't know what that means. Well, actually, we are seeing what it means in pertinent part in a very high-profile example, the celebration of marijuana usage sanctioned by the state for the purposes of finding another revenue stream. And what of that? Because, Alex Berenson, for example, former New York Times reporter, as you know, was writing about this before the pandemic, about the heightened incidence of psychosis among heavy marijuana users, and writing about trying to educate people about, this is not your parents' Woodstock marijuana. The THC content is 20 and 25x as powerful as it was back in the 60s. What about that? What about the idea that the state is sort of speaking out of both sides of its mouth, even to the harm reduction strategy? They always say, don't do this, or you use this responsibly, whatever using fentanyl responsibly means, or having these sites like you're describing. But on the other hand, please get out there and smoke as much weed as possible because we've already budgeted for and spent the money we expect to recoup.
Yep. Well, and in fact, I think part of what you're seeing is that states are not making nearly as much off of marijuana tax revenue as they would like to. Some of this has to do with demand during the pandemic. Some of this has to do with when you have, if your model of the price of marijuana comes from the prohibition market, when you no longer have a prohibition market, price will be driven down dramatically, and so your tax revenue will be lower. No, I think it's right. There are arguments I don't ultimately agree with, but persuasive arguments that say we should legalize marijuana because it's not worth the effort and the cost and money lies to prohibit it. I think that's probably wrong, but that's a respectable view. But we've gone very quickly from that to failing to recognize that marijuana is a vicious substance. As you alluded to, it has significant mental health implications. The most persuasive evidence for psychosis. There's some evidence associated at certain use levels with anxiety and depression. It's also just my friend, the drug policy researcher John Calkins, calls performance-degrading drug.
Yeah.
Everybody knows somebody who's a stoner whose life revolves around getting stoned, and they're far less functional than they would be otherwise. And it's not good for our society to live like that. It's not good for them to live like that. So even if we think pot should be legal, that we shouldn't prohibit it, that doesn't mean that we want the state to condone or actively encourage that lifestyle, because it's not good for anybody.
He is Charles Lehman, fellow at the Manhattan Institute, working primarily on policing and public safety, and a contributing editor at City Journal as well. Do check out his piece we were discussing, Just Say No to Xylazine. Charles, thanks for joining us again. Appreciate it.
Absolutely. Thanks so much for having me on.
Thank you, and he joined us on our turnkey.pro answer line.
It's like a hot, steaming cup of information to start your day. It's Chicago's Morning Answer on AM 560. The Answer.
A storm is on the horizon, and you need to keep the lights on no matter what. Your business relies on the power being on 24/7. It's the lifeblood of your data and computer systems. Weather-related outages from the power company are not acceptable. Your need for a source of power that's reliable 24/7, along with round-the-clock service that can dispatch technicians to your site immediately, is mission critical. Your business needs Charles Equipment Energy Systems on speed dial. These are the big boys, not residential or solar, but reliable industrial generators for emergency backup or events. When you need more than a 100-foot extension cord plugged into a small engine generator, call Charles Equipment Energy Systems. They keep the lights on with rental generators for job sites or power outages. A storm is on the horizon. Plan ahead. Call now to prepare generators for storms and potential power outages. Call 630-834-6000, 630-834-6000, or charlesequipment.com.
Your kids won't be thinking about school very much this summer, but it's the perfect time for you to think about where you'll be sending your child back to school this fall, really just a month away. More and more parents thinking about private Christian school, maybe that's you. Well, private school has never been more affordable thanks to halfpriceschools.com, where you can find tuition vouchers for private schools across Chicagoland, available at half of the normal price. No catch, simple. Find a school near you, purchase the tuition voucher, and prepare to send your child off to school this fall. HalfPriceSchools.com has schools located all across Chicagoland, including Christian Liberty Academy in Arlington Heights, Emmanuel Lutheran in Palatine, Kingswood Academy in Darien, Trinity Lutheran in Lombard, and many more. But don't delay. Summer is not going to last forever. Schools will be starting again before you know it. Visit halfpriceschools.com today. Again, many of these vouchers have already sold out, so don't wait. Visit halfpriceschools.com today. That's halfpriceschools.com.
Cher fans, do you believe? Make your dreams come true when Tribute Artist of the Year nominee Lisa McClowry takes the stage as Cher to sing 2 great nights with her band. Saturday, July 29th at the Des Plaines Theater and Sunday, July 30th at the Arcata Theater in St. Charles. Celebrate 6 decades of Cher in an amazing live music and multimedia production. The beat goes on.